Hello, my name is Hillary Weber, and I am the owner of Unleashed Pet Services, and I have here with me
Brenna Gray, the owner of Premier Animal Wellness and Surgery, also known as Paws.
All right, today we're going to be actually talking about dental health because February is Dental Health Awareness Month. Is that right?
Yes, yep, it is Pet Dental Month this month.
Awesome. So what are the biggest things? Let's say I just got a brand new puppy. What is the first type of information you give owners, maybe for their puppy, to help them be ready for things to watch for with dental?
Yeah, so the first thing, when we've got puppy teeth in, we're not overly worried about cleaning them and things like that, but just teaching our puppies how to chew on toys correctly, and making sure that once we get those adult teeth in, which usually come in around 4 to 6 months, we preserve them and we don't fracture them.
Yeah.
So many dogs have fractured teeth, which then can, let bacteria in and result in tooth root abscesses.
Right. What types of things do you see when, like with young puppies, that may and I say accidentally because sometimes it's just lack of knowledge, but of knowing what puppies can have to chew on that could be dangerous for that?
So, and Hillary can probably talk more to this, but chew training is really important. But things, kind of our general rule of thumb, especially with dogs that we've seen have a fracture on their tooth, is if you can't sink your fingernail into it, it is hard enough that it could break the enamel on a dog's tooth.
Okay.
So nylobones, we do see a lot of dogs that have fractured teeth from nylobones, from simply just biting on them too hard.
And those include benny bones, right?
I'd have to look at a benny bone to know, but I know that like the nylobone brand is, it's a very hard plastic.
Okay.
Deer antlers can also be very hard. And then actual bones, a lot of people, our thought process is, they're dogs, they chew on bones and things like that. Fresh bones from animals that have recently passed are really soft. As bones get older and dry, they get harder and harder. So while fresh bones can be soft, old dry bones are very hard and can also break teeth.
Okay. So then what about, because the antler training, first few things popped in my head when you were talking. One of the things that I think about when I am training a dog for making sure, because it's a lot of times they like to toss it back in their mouth and they want to chew where their teeth are like huge jaw, like their jaw, and they like to toss it back there and chew. And that's where I've always heard is the most dangerous place to have them chew those hard things. Is that right?
Yes.
Okay.
Yep.
Okay.
And again, like if a dog, they can't get as much force. They can get a lot of force, but maybe not quite as much force if it's on half their mouth versus the whole mouth. So kind of thinking about things like that when we've got these puppies in.
That makes a lot of sense. Would you say that obviously with antlers you still have to be very careful, or like hard things like that, but in the front it's probably a little safer for them?
And I certainly have patients that, I have some patients that can chew on literally anything their entire life and it's okay. And then other dogs are just really aggressive big chewers and could break a tooth on probably anything. So that's just, it's a little bit of a, there's not one perfect bone or chew toy that I could hand to every single dog and say, this is safe, this is what I want you to use. You've got to keep an eye on your dog, watch how they're chewing. Are they really gnawing on things? And know if it's okay for them.
Right. That makes a lot of sense. And that's something I definitely do. I watch a lot of the dogs, and I recommend this to people, is to make sure they're not tossing it all the way back.
Yep.
And, trying to encourage them to chew when they're chewing on something on one side.
Yep.
Because I personally always get nervous if they put it in their mouth, especially when it gets smaller.
Yes.
Because my first thought is bowel obstruction.
Yeah.
And I'm always afraid they're going to swallow too big of a piece and maybe have it be a problem just trying to swallow it. But so I always try to encourage them to chew on their side and to kind of like pull pieces.
Yes.
Just smaller, less like big chunks trying to rip off. would you say that that's also a good?
Yeah.
Okay.
Yeah, absolutely.
Awesome.
And then kind of the next thing that we start looking for with these puppies are, do they have any malocclusions? So do they have an overbite? Do they have an underbite? You know, is there any issues there? What can be done about that? Well, it depends. You know, they do not general practitioners like myself, but there are board certified veterinary dentists that do orthodontic work on dogs. And then one of the things that I always warn people about or talk about is if we do have an overbite or an underbite, are those opposing teeth going to cause issues? And we need to watch that closely. And you know, sometimes we end up removing a healthy tooth because it's traumatizing the other
because of the way the jaw sits.
Because of the way the jaw sits. So those are kind of our biggest things with puppies is just start watching how are things coming in. As they get a little older and they do have those adult teeth erupted, we should never have a baby tooth and an adult tooth that is fully erupted in the same location. And if we do, it needs to be extracted as soon as possible so that food can't pack between those.
Right.
We don't want to have that adult tooth die because of the pressure of those baby teeth.
And when you say erupted, does that mean like it's come through or?
So once it's and not just like peeking through, but once the adult tooth is fully out, if the baby tooth is still in there, it needs to come out.
That makes sense.
You know, certainly in many dogs, there's going to be a short period of time where the adult tooth is coming up and maybe the baby tooth is still hanging on for a little while, but it should come out all the way.
Okay. Now, what would you recommend when dogs get older, or maybe you've rescued a dog, or you're trying to, what other things would you want to be watching for?
So then as dogs get older, keeping their teeth clean. And there's a variety of ways, just like with us, that we can do that. So one of the things that we always talk about, so one, regular exams. During every physical exam, we check their teeth, their tongue, their gums, their hard palate, their soft palate, try and look temperament based. You know, some dogs are like, nope, not going to open mouth. Nope, you're not going to look at my teeth the best. But we look as well as we can.
Right.
And then making sure that their teeth stay clean. So dogs can build up lots of calculus on the teeth, which then puts pressure on the gums, puts pressure on the bone, and can start causing the bone to deteriorate and go away. And then that gingivitis can let a lot of bacteria into the bloodstream, go to the heart, cause issues, go to the kidneys and cause issues. So trying to keep the teeth as clean as possible. Ways that we can do that, teeth brushing, of course. But then there's also we'll call it an association or a council that approves products that actually clean the teeth. And if we can intervene early, so usually around 1 to 2 years of age, and start those products, we can keep those teeth pearly white. And then, you know, annual dental cleanings are very common in especially small breed dogs. Large breed dogs, generally speaking, have a little bit better teeth and a little bit easier time keeping their teeth clean. But getting in there and, you know, we do take x-rays of their teeth when they're on the dental table to look and see what does that root look like. You know, we can only see about half the tooth, so we want to see underneath. I also brought a probe with me. You know, just like when you go to the dentist and they probe your teeth, we probe we take our x-rays, we probe along the teeth. Everything should have about a 1 to 3 millimeter probing depth, sometimes 4 if it's a larger dog. But if we're getting pocketing or anything like that, sometimes there's some early intervention things that we can do to prevent that and then save the tooth.
Okay. So when you're probing, that's just kind of like touching the teeth, and like what exactly are you looking for?
Some dogs with dental x-rays can only be done under anesthesia. So they do have to be under general anesthesia to have their teeth cleaned well. But we kind of go along the outside and then the inside of the teeth and probe between the tooth and the gum. And there should be a very small amount of space there, but there should not be any big pockets there.
Where it can get stuck.
And then on the other side of my probe is kind of a more firm pointy side. And with that, I'll go along the teeth, and if there's any fractures in the enamel, or if there's any fractured off, really probing that and making sure it's not hard and that we don't have a communication, and then kind of using the probing plus the dental x-rays to get a full picture of what that tooth looks like.
Okay, that's really neat. That's very interesting. What would you say if your dog is in that one, you said 1 to 3?
Yep.
What are the products that are recommended that you could start using?
Yeah, so again, there's the Vet Oral Health Council, which VOHC, they have a little seal of approval on the products they recommend. So things that I really like, and so we carry a couple things in clinic. Their Science Diet makes an oral health care food, so it's dog food. It's literally, you feed it to the dog, it's a big fiber matrix, it's a big kibble, cleans their teeth. That's fabulous. You have to feed your dog anyway.
Yeah.
Another one that I really like is there's a powder that you can sprinkle on their food that it's a little bit gritty. It's really well tolerated by most dogs. And again, it helps clean their teeth. Greenies treats are also an option. Sometimes they're a little high in calories if we're trying to watch weight. So it's always kind of a balancing act and things like that. But
would you say that there, and I know you mentioned greenies and a couple of those things, would you say that there may be sometimes where other dental types of treats out there?
There's lots. Yes.
Just to maybe look for that seal.
That seal, yep. Okay. So if you go to PetSmart or anywhere, there's a ton of products. And actually, the Vet Oral Health Council has an amazing website, and it has lots of links to their products in different places that you can get them.
That's good to know. That's a good place to check out then.
Yes, yep.
Awesome. Well, what would you say as your dog gets older and maybe you didn't do as much of that stuff to begin with, and you want to start working on it, and maybe you're going to do the once a year cleaning, are there any other things that you could do?
Yep. So I'd say, if we have too much calculus on the teeth, then we're not going to clean it with oral care products. Even if we do everything we can at home, just like us, at some point we need to go get our teeth cleaned.
Yeah.
So doing that, maybe it's once a year, maybe it's every other year, dental cleaning and getting the teeth. We scale the teeth, get all of the calculus build off, and then really important that we polish them and make sure there's no micro cracks or crevices that buildup can come back on. And then we always say, okay, we've got a nice fresh start. Let's go back and start using some of these at-home products to help keep those teeth clean again.
Awesome. And so it would be the same kinds of products?
Same kinds of products, yep.
Awesome.
Same kinds from the beginning. And then, maybe we're starting later. Maybe we didn't get there soon enough. We've had to take a tooth out. We can always get everything started over and start fresh again.
That's very good to know. Are there any other tips or helpful things that you can think of that would be helpful for people at home to think about, whichever age or size their dog is?
I think the biggest thing is just intervening early. And then if sometimes we get patients that have come, maybe the owners didn't know to watch the teeth, maybe it's a rescue situation, and we have to take all the teeth out. I have one of my assistants, her dog came in as a little stray, and unfortunately within the first 2 weeks of her getting it, we had to take out all of her poor little teeth because they just were beyond repair. But sometimes dogs do better with no teeth at all than they do with bad infected teeth. So especially if we have a patient that's just having chronic infection and issues in their mouth, getting those out. And I've literally had patients or owners tell me, it's like a new dog.
Yeah.
You don't realize how much it affects them until sometimes you get stuff out.
To look at it though, and that also tells you that there's always an option to try and help them.
Always an option to try and help.
And I think that's important to know that that's there.
Yes.
Awesome.
Yep. So, and cats are important too. Cats also have teeth issues. I guess we should mention them.
Yeah.
And definitely greenies treats for cats work really well.
Yeah.
The powder on the food works really well.
Okay.
And then dental care for cats too.
With the powder, do you have different ones for cats and ones for dogs, or is it?
Yes. Yep. There is a different one for cats and then a different one for dogs.
So just making sure you're getting for the right species.
Yes. Yep.
Yeah.
Yep.
Okay. Awesome. And then how often with cats do you have to, is it the same? With the getting
it depends.
their teeth cleaned and
It
stuff?
depends on the cat. Again, with the dogs, it depends on the dog a little bit too. But yeah, some cats certainly we see on a yearly basis. Some cats, generally speaking, can go a little bit longer. Sometimes cats can get like a viral infection as kittens that can give them really, really bad inflammation in their mouths. And then sometimes we're taking out teeth, not because the teeth themselves are bad, but because their body is having kind of this immune response to these teeth that they do much better without.
But that's good to know. I was curious if there's any difference with cats and dogs.
Yeah, they definitely have different. Cats are much less likely to fracture their teeth.
Okay. Well, they don't chew
They're not
bones.
chewing on stuff.
Yeah.
Bones, rocks.
Yeah.
Goofy things. But they are much more likely to have resorptive lesions where their body just kind of starts resorbing the teeth roots. Okay. And then we have to take teeth out because of that if we can't kind of get it under control.
That makes well, it's interesting to see the differences between the two and to kind of know what to look for.
Yeah. And then I guess just one more little thing to think about, and actually happened to one of my personal dogs when I was younger before I became a vet, but he was a really big tennis ball dog, and tennis balls collect sand, which then is like sandpaper on the teeth. And just like filed his poor little canine, just the tips before we noticed it and stopped. But just something to think about that, sometimes some of those balls that collect sand can
that makes sense.
Abrade those teeth down too.
Well, especially even like this time of year when there's a lot of sand on the ground and the streets, that could get on everything.
Yes.
Doesn't matter if you have sand in your yard or not.
Yes. Yep. Yeah. Exactly. So.
Wow. Okay. That's good to know too. Well, I can't think of any other questions for you, but I feel like this has been super informative for both cats and dogs, and I am excited to keep learning more.
Yeah.
Awesome. Well, thank you, and stay tuned.
Thanks for joining us on this week's Positive Talks. Whether you're a devoted dog lover, a curious cat parent, or somewhere in between, we're glad to be part of your journey. Until next time, stay curious, stay kind, and keep it positive.